Okay, hi Emma, and I'd love to know how this sounds, if you can hear me and if there's any loud buzzing. I was having some trouble with buzzing noises earlier this week with this platform, so make sure we have a clean recording. Oh, yay, I'm so thrilled. Okay, fantastic. And it looks like it's just you and me for the moment. We have about 8 people registered, and I know that some folks are just looking for the recording. So I'd love to go ahead and give people just maybe 2 more minutes to arrive before we start with the content. So I'd love to take the luxury of just hearing, Emma, a little bit about who you are and what you're most interested to learn tonight. Um, One of the benefits of being a live attendee is that we can interact and I can hopefully um, make sure to specifically answer your questions. And in so doing, I'm sure that we'll also be able to catch some questions that other people likely would have had as well. So I'll wait to listen for that. And meanwhile, we'll just um, see if anyone else joins us before we get going on the planned presentation that I have. Okay. So you're a clinical social worker working in housing program. Um, Maybe you can tell me what DV stands for. Domestic violence, probably. Um, Domestic violence housing program, lots of trauma. Particularly interested in herbal medicines that support sleep and relaxation, as those are issues that arise with my clients and myself regularly. Okay, yeah, you're in the right place. Um, you're definitely in the right place. We will be talking about those pieces a little bit tonight. And at the very least, my hope is that even though I know for the vast majority of people who are clinicians and practitioners in the mental health world, um, it might be uncomfortable to make a lot of recommendations about herbs or things that are outside of your official scope of practice. But at the very least, what I'm hoping that we can open up tonight is a sense of how to harness these things for your own self-care, and to really expand your personal toolkit, as well as to just expand the awareness that you have of what is out there to support your clients and your patients. So that might not mean that you are always the person, making those suggestions, but that we help to hook you up with the resources that are available for you and also for the communities that you serve. So that is what we're up to tonight. Um, so I'm going to go ahead and get started, and we will hope that a few more people join us live. And if not, then Emma, I really encourage you at any point that you have a question or that you want me to slow down, please be extra vocal through the chat, because that will really help the people who access the recording later as well, because there are going to probably be times when I tend to go a little bit quickly about these things that are very comfortable for me that might be brand new to some of you who are listening. So here we are, intro to herbal medicine for people who are working in mental health in the front lines. I want to just say, first of all, how pleased I am to be here and offering this topic. I personally am a clinical herbalist working here in Washington, D.C., and also remotely. A large number of my clients I meet with over Skype, and end up treating people from all over the world, which is pretty cool. And one of the things that comes up consistently in my practice is mental health. It is almost always the case that my clients have a presenting physical health concern, and then also a mental health concern. And often the two are quite interlinked because there is a stress or a trauma pattern that is underlying both of them. So, or that at very least the stress sort of pours the fuel on the fire for both the mental health and the physical health problem. So the most common referral that I make in my own practice is to mental health practitioners. Psychotherapy is the number one tool that I refer people to when they're working with me with the herbs. And so it occurred to me that I would really love to share what is possible when we marry these tools of the therapeutic, the psychotherapeutic interventions with the possibilities that are offered through natural medicine. So that is what we're going to be all about tonight. And I really hope that this will be a doorway for each of us to get to know each other better. So especially for those of you who are here in the district, I'd really love to know what you're up to and who you work with, because as I said, I am often referring to mental health professionals. So I would love to know a little bit more about each of you. So I'll share my email address at the end and we can all stay connected. So the last thing I want to say before we dive in is that the word intro is a very important word for this webinar, because herbal medicine is a huge topic, clearly, and the ways that it interfaces with mental health care as the system currently is are complex. There are a lot of possibilities, and it's somewhat new territory. So what we're going to do tonight is really kind of open everything up, and I'm going to cover as much as I possibly can. But let's make a commitment to this being an ongoing learning and an ongoing conversation, knowing that we will not solve every single question or concern in this one, hour and 20 minutes, hour and 30 minutes that we have tonight. Okay, thank you, Emma. Yeah, agreed. I'm so glad that you're with me. Okay, so just a couple of guideposts for our journey together, which hopefully will continue far, far longer than just for tonight. The first one is that the number one rule is to follow your own sense of your scope of practice when you are dealing with any new complementary modality. So I'm sure I don't have to tell you this. I'm more sharing this because I want you to know that I know. And so it is really important that we think about this exchange as a way of opening up the possibilities for cross-pollination and referral, and that you don't feel any sense of pressure to advise your clients on these matters after this session tonight. The next thing is that I am going to share pretty openly, it's kind of just part of my personality, pretty openly about the companies that I do recommend, because one of the most important issues with herbal medicine is how do we actually source remedies that are safe and that what's in the bottle is what it says is on the bottle. But I am going to, for legal reasons, refrain from naming any companies that I do not recommend. So I will ask you to read between the lines a little bit. There are probably some companies you've really heard of that are not going to make my list of I recommend them. If you have a specific company that you're wondering about, feel free to ask me, and I'll just tell you either I recommend it or I don't. And there are ones that I feel strongly about that I may not mention, and you can infer as to why that might be. And then lastly, I want to just say, please, this is not a drink the Kool-Aid kind of a learning environment. I want you to bring me the hardest questions that you have. I want you to bring all of your skepticism, and I want you to bring any conflicting emotions that you feel about anything that I share. And my commitment to you is that if you have a question that I can't answer just off the top of my head, I will tell you, I can't answer that, or I don't know. And that's especially true for some of the herb-drug interactions or some of these more biochemical pieces. Generally, I lean very heavily on not just a broad understanding like I'm going to share with you tonight, but on very specific resources, which I'll share with you for getting into the nitty-gritty about that stuff. So please, openly and freely ask any questions and share your doubts. That's what I'm here for. And it's also okay for us to disagree and see things differently. So if we can agree to all of that, then, and then lastly, please do not share this actual presentation as a file with other people. I am going to make this available for a donation just for the recording, but I ask that you not share the recording with people who have not contributed in some way financially, which can even just be $1, just for the energetic cleanness of that. I ask that you not do that, but certainly share the information that you've learned and spread that widely. And I'll make sure to make a link available for people who might like to access the recording later. Okay, thank you so much, Emma. Okay, so let's get right into it. So let's start out comparing and contrasting herbs and pharmaceutical drugs. So a few days ago, I was speaking to a psychiatrist who was working with one of my clients, and I really appreciated her perspective so much. She said to me, she's like, I have to tell you that from my perspective, these things that you are working with, these herbs, they are drugs. It's the same thing. And I don't see it as just a benign little couple leaves of green tea. I see it as a drug, and I have a great deal of respect for what it is that that you're working with these plants. And from my perspective, I don't understand why someone would want to trade one drug, a pharmaceutical drug that they're taking, for another drug, for an herbal drug. So herein we have the perfect statement from the medical profession, embedded in it with all of the concerns that people have about herbal medicine. So I want to start by activating you a little bit in the chat, and if you're listening to the recording, I want you to think about this for yourself. What are your intuitive assumptions or biases about the difference between herbs and pharmaceuticals? There's going to be an intellectual side to understanding what the difference is. And we also want to really get our minds around what is the aesthetic difference? What is the emotional feeling of difference we have? Because sometimes those things can be helpful, but sometimes they can get in the way of making a clear decision about which thing is going to serve us better for self-care or which thing is going to serve a client better. So what do you think? Assumptions, biases, intuitions about the difference between these two things. And Jihan, I'd love to hear from you too if you have access to chat. Emma got a lot of burden on her here to be the only person chatting. Thank you. What are the differences? There are no wrong answers. It's just helpful to know where you guys are starting from. Okay. Emma says, great, this is great. Emma says, herbs won't be as strong as pharmaceuticals. They won't be as effective in treating negative mental health symptoms. Access to herbs is a privileged thing and not available to everyone. Great. Jihan says, sure, herbs to me appear less harmful and to have less side effects. Okay, great. This is great. We've covered a whole lot of the ground here of what people sort of sense and feel. So a lot of the bias that you're going to notice, maybe in yourself and also with clients, is that there can be a feeling that because they are natural, herbal medicines are somehow less harmful and that they will have fewer side effects. In a lot of cases, that is absolutely true, in my opinion. It's part of why I'm an herbalist and not an MD. And there is also a big piece that is connected with what Emma shared, that part of the nature of what herbs can do is that they can work a little bit more gently. And so they are not going to be as quick in how fast they take action. And they are not as well studied in terms of double-blind, placebo-controlled kinds of research in humans. There's a lot of research about herbs, and there's a lot of experience from thousands of years of continuous practice. However, when it comes to really knowing exactly what's going to happen when you give an herb to a person, especially someone who is in a state of severe crisis or who is having severe mental health symptoms, then we have to ask ourselves the question if we're really willing to take that risk of not being exactly sure how it's going to go. And then, Emma, I think that this is somewhat true, and it's like the biggest pity because herbal medicine really should be the medicine of the people. But there is a way that it has kind of become part of this sort of privileged elite sort of way that people are accessing wellness and natural medicine and acupuncture and these kinds of things. So we will talk a little bit about some places where we can find resources for people who are interested in working with herbs and who do not have a lot of disposable income. Yeah, that's good. Yeah, I can't see you nodding, but it's great to have you with me there. So here's how I like to think about the main differences between herbs and pharmaceuticals. So I want you to imagine a spectrum, okay? And on one side of the spectrum, I'm going to do this with the right hand. On one side of the spectrum, all the way on the far right, we have the drugs, okay? So this is where we've got our antidepressants and our, benzos and antipsychotics and, all the actual drugs are over here. And then on this side, we have food. So food is purely nourishing. So even if somebody is quote unquote addicted to food, we think about that a little bit differently because part of the definition of a drug has to do with being a non-nutritive substance, right? Do you remember that about like the pure definition of a drug? It's a non-nutritive substance that affects physiology. So a nutritive substance that affects physiology is considered a food, is classified as a food or as a vitamin supplement. So if you think about the differences, sorry about that siren, if you think about the differences between food and drugs and the similarities, on one hand, both of them can be quite therapeutic. And especially those of you who are working with populations who are living in poverty or who have other issues that are interfering with their nutritional status, you will see quite often that things like magnesium deficiency from not having enough green leafy veggies and not having enough whole grains in the diet, or B vitamin deficiency, these things can lead directly to mental health symptoms just because there is a nutritional inadequacy. So food itself is therapeutic or healing because it's supplying part of what the body naturally needs in order to function well. On the other side, and then food is also complex, right? So like if you eat like a whole bunch of spinach, the spinach doesn't have just one chemical in it. The spinach is complex. The spinach has fiber, the spinach has iron, the spinach has folate, the spinach has some amount of carbohydrate and calories, even though it's very little. And it has flavor. And then the spinach is going to act differently in your body depending on how you serve it. If the spinach is raw, it's going to be different than if it's cooked and served with vitamin C, where you're going to absorb more of the iron, So food is contextual, and food is complex. All the way on the other end of the spectrum, this is backwards for me, so I'm like playing with how to do my hands. On the other end of the spectrum, where we have the drugs are not complex. The drugs are simple and concentrated, and they do not have nutritional value. They are strongly therapeutic, and they are often very predictable. They are contextual because different factors will affect the absorption of drugs, but they are not so deeply contextual as food when we think about cooking and the complexity of that. Now, herbal medicine exists in the middle of the spectrum between food and drugs. So an herb can be close to this food side. So an herb could be something like oat straw infusion, for example, or stinging nettle infusion, where it's actually a lot more like a food than it is like a drug. It's primarily supplying nutrients to the body in a very easy to absorb form. On closer to the drug-like side of the spectrum with herbs, we have herbs that are very, very strongly therapeutic in their actions. So some of the herbs we're going to talk about tonight, like for example, our password for getting into this room, and one of my favorite herbs, lobelia inflata. Lobelia is a parasympathomimetic. So what it does is it actually induces the parasympathetic or rest and digest branch of the nervous system. And it does this with a very small dose of herb. So you take about 5 to 10 drops of the tincture or an alcohol extract of that plant, you will feel something happen. And it will feel relaxing, and it will relax the smooth muscle of your chest, it'll slow your heart rate. You'll feel pretty good. Unless it's contraindicated for you, in which case you will feel bad. And we'll talk a little bit about that. But that's a much more drug-like effect than eating a bowl of spinach and replenishing your magnesium stores, okay? So is this making sense that the primary differences between herbs and drugs have to do with where they are placed on that spectrum? Some of them are going to be very, very food-like. Some of them are actually going to be very drug-like, to the point that they have, toxicity that is comparable to the drugs. It just really depends on what the plant is and where it lives along that spectrum. So let's pause before I move to the next slide, and then take any little questions that are bubbling up now about the differences between herbs and drugs. And then we're going to talk about contraindications for using herbs in general rather than specific herbs, which we'll cover a little bit when we talk about the specific herbs. Okay, no questions right now. Great. So the main thing is that herbs in general are safer. The complexity of the herbs is, I believe, a big part of what lends them their safety. Another point I wanted to make here is that if you think about the difference between a monoculture, like fields and fields of genetically modified soy, the advantage of that is we know exactly what that plant is going to do. It's very well controlled. It's very, very clear, like how it's going to behave and how resistant it's going to be to, Roundup or whatever it is. And it's going to be prolific, and under the conditions that we plan, it's going to do great. It's going to do like better than great. And that's why we created it, because it's going to do better than great. And at the same time, there is a certain vulnerability that comes from that, like, such prolific greatness of the genetically modified soy. It comes at a cost. And so similarly with drugs, that is where sometimes it's much easier to have side effects that are unwanted. It's a lot easier to have complications that make people resistant to taking some of these things. Whereas with herbs, there's more diversity of the actual chemical and nutritional substances that are in whatever it is that you're taking. And so it helps a little bit to mitigate some of those problems that can happen when we have, a field of all the same plant instead of a field that is biodiverse. It's a little bit of a clunky metaphor, but I think it gives you the picture of both the advantage and the disadvantage between herbs and drugs. Okay, there are some times when we should definitely not use herbal interventions. If you know of any of these times, or if you have any sense about clinical situations in which you would really feel worried if a particular client came to you and said, hey, I have great news. I'm working with an herbalist. I'm using herbs. I'm going off all of my meds and I'm taking herbs now. Go ahead and type that in if you would like to. There might be things that you would sense or catch that wouldn't occur to me because I am in a different practice than you. But here are the things that I would say. First, some physical contraindications. Number one, in general, if someone is taking Coumadin or warfarin, any kind of blood thinning medication, generally this is not a great time to use herbal medicine. Even changing the amount of green veggies in somebody's diet when they're taking Coumadin can be really a problem and can be potentially fatal because if your clotting levels change, you can die. So if somebody is taking blood thinners, I would say steer them away from the herbs in general and have them use pharmaceuticals, somebody who's really understands medicine management with people who have that kind of physical health situation. Next, on the physical side, yeah, Emma, I think this is great. People who are using street drugs, crack, heroin, and PCP. Yeah, at that point, somebody's physiology is so different from anything that's going to be in the traditional literature because those drugs did not exist back when traditional Chinese medicine and Ayurveda and Western herbalism were in their infancy. So we certainly don't have, a double-blind placebo-controlled data about how to work with those folks. We definitely do not have long traditions of experience understanding how to work with that. The piece that I would say with people who have serious addiction and chemical dependence is that oftentimes the nature of their lifestyle means that there's significant nutritional depletion. So the tiny caveat that I would share is that it would probably be appropriate in some of those cases, and compliance is going to probably be an issue unless somebody's in a very stable environment and beginning a recovery program. But it could be appropriate if people are wanting to recover some of their nutritional status, which will definitely help with how they're feeling, to use very, very gentle, nutrient-rich herbs only as a means of replenishing them, and especially if there has been concurrent alcohol use and their digestive system is pretty ripped up. Something like stinging nettle infusion or red clover or oat straw, something like that that doesn't have any psychoactive properties, that is very nutritionally replenishing, could actually be lovely. Or if a little bit of chamomile tea helps them take the edge off, I would be fine with that too. But gentle kind of stuff. Another contraindication for herbal intervention is if you have a sense that a client is seeking the herbs because there is shame or denial that's at the root of the reason that they don't want to use pharmaceuticals. So part of this fallacy of like natural is always better can have to do with a feeling that if I'm taking an herb and I got it over the counter from, Whole Foods or from the natural market, or I picked it out of my garden, then I don't have to wrestle with the fact that I'm coping with mental health challenge, because it's kind of like it's not really a thing, it's natural, it can feel like a way for somebody to wiggle out of needing to really take stock of what they're coping with and what their challenges are. So if you get the sense that somebody is moving toward the natural remedies because they don't want to accept a diagnosis or they don't want to really get help in a serious way, that would be a contraindication for me. Another contraindication, this applies if someone's not working with a practitioner, but another contraindication could be pregnancy. Again, there are a lot of times when using herbs are actually safer for a person who is pregnant, but there can be a gap in the data as well. So it's very much dependent on what herb are we talking about, and is this person under the care of an herbalist, or are they self-medicating with herbs? And then the last piece would be to just make sure that this is somebody who is able to comply. I try not to use the word compliance in my practice, but you know what I mean. Like if this is somebody who can actually be consistent with using their remedies, then this can be a good way to move forward. If this is a person whose mental illness is severe and persistent enough that compliance is going to be a problem, then herbs are a little more complex to use than drugs. They're different than drugs to use, and they if somebody is not able to be compliant, then this is not a good answer, because it too easily allows somebody to potentially lapse into a place where they're just not being treated at all. Okay, contraindications. I think that's pretty much it. Oh, and then of course there are certain herb-drug interactions. So there are times, particularly with the antipsychotics, that certain herbal remedies used concurrently with antipsychotics can be super helpful with extrapyramidal type symptoms, with just managing some of the things about those drugs that make them really hard to stay on. So the herbs can walk hand in hand with traditional therapies, but you have to make sure that there's both an herbalist on the team who knows about the herbs and a psychiatrist on the team who's really good with medicine management and would be able to help downregulate or upregulate the dose of the psych meds depending on how somebody is responding to the herbs. So in that kind of a case, you need both members of the team because the psychiatrists don't know about the herbs very much, except to know sometimes some of the scary things. And the herbalists don't know about the drugs enough, obviously, to do medication management. So if you don't have that, then for somebody who has serious medication that they're on, then herbs are a no. Okay, any questions here before we start talking about some specific herbs and getting into that very fun part of the talk? I'm just going to drink a little bit of water here too while I pause. Okay, no questions. Jihan, I saw you typing as well, but you might have stopped. Okay. Oh, that's a great question. So Jihan is saying, if someone has not done well on psych meds historically, would herbs be recommended to try? Almost always, yes. In my clinical experience, I have seen a lot of young women. So it's a pretty specific population that I have worked with. And I've seen a lot of young women who have not done well on antidepressants and benzos, or who were feeling kind of ambivalent about taking benzos in particular because of a sort of addiction history in the family. And maybe a sense of, saying like they think they have an addictive personality or something, and just were uneasy about that. I have seen those women do really, 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 really well with herbs. I don't know from personal clinical experience how much that maps onto other populations. But what I would say is that, yes, this is a great time to consider referring for herbal medicine. Part of what herbal medicine does in the hands of someone who knows what they're doing is that instead of treating on the basis of a named condition, with sort of, check these number, 5 out of 10 or how, whatever it is in the DSM, and then you have unipolar depression. Instead of working that way, the diagnostic process for herbalists is different. We look really at the way that the person shows up as a whole body. So even if digestive symptoms or skin symptoms or how hot-natured or how cold-natured they are, even if that's not really part of the named pathology that they're presenting for, we take all of that into consideration, and it's something called pattern diagnosis or pattern assessment. And what it often allows us to do is, 3 women who would all have the same diagnosis of unipolar, major depression in a DSM kind of system, would have 3 different diagnoses potentially within a Chinese medicine system that I work with. So each of them would have a remedy that the base formula of what their herbs are going to be would be totally different. And then an herbalist has the potential to also customize that root formula with additional herbs or subtracting herbs based on that particular person's symptoms and sort of their constitutional type. So a lot of times what this allows us to do is to completely sidestep some of the issues and problems that come up in terms of side effects that get in the way of compliance, and that also just, or just lack of efficacy. And then sometimes the reason that psych meds don't work is that a nutritional deficiency is at the heart of the problem. This is not always the case, and we can't reduce everything to diet, as some sort of alternative medicine people will suggest. There is pathology aside from a poor diet, but sometimes the reason that medications aren't working is because the raw nutrients that the body needs in order to function the right way just aren't there. So that's another place where a comprehensive herbal medicine program is helpful, because they're also going to look at where are those nutritional gaps. If somebody's working within a traditional insurance kind of system, a referral to a dietitian would also accomplish the same thing. And that would be another great thing to just sort of tuck away in your mind from this seminar, is just to really remember that sometimes it's not about the drugs, it's not even about herbs, it's just about food and certainly all of the psychosocial stuff that you guys are already working on is a huge piece. Okay, so before I start talking about the herbs that I have planned to bring up, I want to hear, what are the herbs that you guys are already using, that you've heard about, that you're thinking about? Which ones do you want to make sure to cover? I know that there are some questions about insomnia and just sort of stress relief. I am sure that you have questions about St. Johns Wort, because that's sort of like the poster child for herbal medicine and mental health. So I want to hear what's already sort of brewing or bubbling. And then I will include all of those, as well as many of the ones that I have sort of planned in my mind as we can. We're doing really well for time. Herbs for sleep, depression, stress, and anxiety. Okay, great. You don't have any particular herbs that you've heard of that you're wondering about? Okay, Emma says, I know very little. Sleep and relaxation are my main issues. Yeah. So true for so many of us, Emma. It's like, those are the big ones. Okay, great. So let's go ahead and start with St. John's wort, because that is sort of the big famous poster child, and it's going to give us a chance to really talk about why, when an herb becomes a poster child, or when you read something, from someone who's trying to sell you an herb, usually, when you read something where it sounds like St. John's wort is the herb for depression, or St. John's wort is an herbal antidepressant, um, that is almost always a vast oversimplification, so much as to be majorly misleading. I hear you about digestion. I was wondering intuitively about that, Emma, when you were typing. So I'll talk about, to keep it on topic, I will mention herbs that work on relaxation and the central nervous system and also have a digestive benefit, because there are a bunch like that. Okay, so St. John's wort. St. John's wort has been labeled this herbal antidepressant, and there's a lot of really good research. There's actually double-blind, placebo-controlled research on St. John's wort. It's really fun to search PubMed for St. John's wort. You get tons and tons and tons of hits. It's been very, very well studied. And one of the things that we have missed, and that you'll see in these studies, because some of them you'll see have really great results and some have pretty ambiguous results, is that this is an herb that works amazingly well when we use it as indicated. And when we overuse it, or when we use it as if it's an antidepressant that just works for anyone with depression, it fails miserably. So St. John's wort, it grows actually here in DC. Those of you who are local, I just picked some like last week. It usually peaks around midsummer. So a little bit closer to like between the solstice and then, you know, end of like mid-July, end of June to mid-July. And it's a beautiful little yellow flower. And when you squeeze the flower, if you can get it between your fingers and you go like this, a deep purplish red dye kind of comes out. And it's this pigment, just like the pigments of the different, you know, rainbow of vegetables that you eat. It's actually a lot of those pigments that have such great nutritional benefits. Sometimes the pigmented parts of herbs also carry some of the most important chemicals that help to give herbs their properties. In the case of St. John's wort, what it is excellent at doing is working directly with the nervous system, with the nerves themselves. So this is an amazing remedy when there is nerve pain or chronic pain and a mild to moderate depression that is relieved by, you know, beautiful, warm, sunny days where like it's like everything seems right with the world because it's so beautiful outside. For that type of depression, St. John's wort is a godsend, and it works better than anything that I have heard of or seen. It is also something that you can help point people toward. It has a lot of herb-drug interactions because it induces some of the liver enzymes that are very active in metabolizing many, many, many drugs and substances. So of all of the herbs that you're going to hear me talk about tonight, St. John's wort is like the king of having herb-drug interactions with stuff, to the point that there are some amounts of concerns even with just hormonal birth control, that it could reduce the efficacy of hormonal birth control. So on the one hand, it's a great remedy to know about and very effective. And on the other hand, it isn't really available even to a lot of the people who might benefit from it because it so often interacts with things. But its power for relieving nerve pain is so awesome that you can actually use it topically for that purpose. So this is a really great thing to know about, and depending on how you feel, this might even feel like it's within an okay zone for you to share with somebody since they won't be taking it internally. And by putting it on the skin, you avoid a lot of the concern about herb-drug interactions. So if you get St. John's wort that's infused in olive oil, Herb Farm makes a good one. It's herb space PHARM. It's a very major herbal company that, despite its large size, continues to use responsible practices and make very good medicine. So that's one of the ones that I recommend. they make a great St. John's wort oil. And this is not an essential oil. This is olive oil that has actually, the herb has steeped in it, and then the chemical properties of the herb have been extracted into the oil. And you can put that directly on any areas of nerve pain. It can be very, very helpful. And sometimes, that relationship between pain and depression is so vicious that when somebody is having a hard time getting pain under control, having something like this that they can use, whatever drugs they're on, whatever's going on, can be tremendously helpful. Using St. John's wort is also often indicated when someone has depression along with vitamin D deficiency. So that would kind of go along with that sort of like gray, seasonal affective type feeling. St. John's wort can be very effective for that kind of depression. And almost always, some amount of movement is also really helpful for these clients. So walking, gentle yoga, hip circles, shoulder circles, whatever they can do to start sort of getting the body like thawed out and moving again can be tremendously, tremendously helpful. The other really famous, sort of more famous herb that I want to talk about, it's really interesting, the really famous herbs, like, I think, seem to have the most contraindications. The other really famous herb that I want to talk about, since sleep and relaxation is a big concern for people, is valerian. So have you guys heard about valerian? Just type in the chat, let me know if you have. Valerian is a pretty strong herbal sedative. And it's really interesting in a couple of ways. Number one, most herbs, one of the ways that you can tell that an herb is sort of denatured or it's not really like very potent is that it loses some of its smell, So if you go to a certain locally owned market here in DC that often has inflated prices and sort of just maybe isn't your favorite organic market in DC, and you open up the bins of the bulk herbs that they have, and you smell in there. There might not be a big difference between like the spearmint and the peppermint. Like it might just kind of smell vaguely minty, but not terribly strong. And the herbs might look kind of brown and old. That's a good sign that you don't want to buy those herbs. You want to buy herbs, even when they're dried, that look vibrant, smell vibrant, like are vibrant. Valerian is an exception because the older valerian gets, the stinkier and stinkier it smells. It smells like dirty gym socks and it smells totally gross. And that actually does not mean that it's more potent. It means that it's older. What valerian does is it is a powerful sedative for about 75% of the population. It is considered to be to have a heating quality. In traditional medicine, we talk about things almost like the weather. We look at the body as a natural system that is an extension of and a part of the rest of the world. So we look at anxiety as being a hot condition, and oftentimes depression as being a cold condition, for example. It's part of how we start to make connections between the patterns that are going on in someone's body. And valerian is considered to have a very hot energy. So for about 25% of people, even though it's this powerful sedative, and it can absolutely induce the effects of benzos, you definitely don't want to combine it with any other sedatives. You don't want to take it along with Ambien. You don't want to take it along with any anti-anxiety meds. And I would have to double check, but I think that there could be some concerns using it along with some of the antidepressants, and you definitely don't want to use it with antipsychotics or anti-seizure meds. Even though it's a strong, strong sedative, for 25% of the population, it will make them totally hyper and they will not be able to get to sleep. And so that is a really perfect case of another reason why saying like, oh, valerian is the natural Ambien or something, why that doesn't work. Also, very interestingly, valerian is one of the few herbs that can create physical dependence. So if somebody is taking valerian every single night to get to sleep, over time, they will build up a tolerance to it. They will need to just keep upping that dose. And then there have been very few, but there have been actually documented cases of people who were habitual valerian users for sleep, who are using it in quite large amounts. That one case in particular, and this person was hospitalized and did not have the valerian, had withdrawal symptoms very similar to benzodiazepine withdrawal. So it's a great herb. It's wonderful for occasional use, but it is not one that I like people to use all the time. And it is not the first thing that I like people to reach for because it's very strong and because it has a paradoxical effect in about 25% of the population. It seems that people who have ADD or Asperger's, autism spectrum kind of stuff are more susceptible to the paradoxical effect. So people who outside of their presenting issue of insomnia, who are this non-neurotypical when they're functioning as a healthy version of themselves, I would be hesitant to use valerian with them. Anybody who has sensory stuff, I would be hesitant to use valerian as the first line of defense. Anything else on valerian? I don't think so. Okay. And then this brings me to another, this is not an herb, but another piece I want to mention about sleep. So very commonly people will use or suggest melatonin for sleep because it's available over the counter. People think it's natural and it's good. So melatonin is not an herb and it does not come from an herb. Melatonin is a hormone. And I personally think that it should not be over the counter. If you use it very occasionally in order to help with jet lag or something like that, it can be all right. And it can be a really important therapeutic for people with fibromyalgia and insomnia that goes along with fibro, because they tend to just not make melatonin. But for everybody else, what happens when you take melatonin, especially if you take it regularly, and crazily, because the doses that are available over the counter are sometimes 5 or 10 times more than what your body will make in an entire day. So if you're taking 5 milligrams of melatonin, that's already 5 times more melatonin than your body would naturally make over the course of a whole 24-hour period. And you're taking that all at once. What happens when you take any hormone from the outside is that your body will start to down-regulate the production of that substance. So if you take melatonin all the time to get to sleep, your body will stop making its own melatonin in order to help you have a normal and healthy circadian rhythm. So please, please, if you find out about clients who are using melatonin all the time, recommend that they get support to wean off and to get their circadian rhythm back in order. This, talk about a thing with tough compliance. So this might be a little bit more for yourselves and maybe for some of your clients. One of the most powerful interventions to help with sleep and circadian rhythm is to get up in time to watch some amount of the sunrise. And if you can't do that, to get sunlight exposure as soon as you can after waking. It helps your pineal gland to send the right messages to the rest of your body, and it actually will regulate your hormonal systems all the way from sort of the very base of things. This is a really great intervention also for people with thyroid-related depression and for women with PMDD. It's equally powerful to any herb that I give people, that sunlight exposure at sunrise or as early in the day as possible. In fact, This is sort of not related to mental health too much. And she had a little bit of depression, but more just to sort of impress you with the power of this sunlight intervention. I had a client who was exposed to the Chernobyl disaster as a young child and who had thyroid. Her thyroid was totally screwed up because of this. And so she had really low thyroid and some amount of depression, weight gain, all that fun stuff. I gave her one herb that has a mild effect on supporting the thyroid. And then she got up and had sunrise light exposure about 4 days a week. And her thyroid levels came back to normal within 3 months. So it's pretty powerful. It's really, really pretty powerful. Hugely recommend it to you and as many of your clients as you can get to give it a try. Okay, so let's talk a little bit more about herbs for relaxation that specifically help to support digestion. So the number one, if I had to choose just one, the number one for this would be chamomile. So almost everybody has tasted chamomile tea or given it a try before. In small amounts, this is a completely appropriate herb, even for people who are taking a lot of medications. This would be an appropriate herb that might provide some relief, especially if it's used in formula with a couple of other things. Could provide some relief to people with extrapyramidal symptoms. But if you're using it just for sort of everyday stress and anxiety, it is particularly calming for that type of anxiety where you get either a stomach ache or loss of appetite or that feeling of needing to eat in order to settle your stomach or kind of ground yourself. Chamomile is an awesome herb for this. And if you increase the concentration or the dose of how much of it you're taking, so, if you have just a nice little pleasant cup of chamomile tea, like, Beatrix Potter, Peter Rabbit kind of a thing, it's not going to have this effect. But if you make really strong chamomile tea, you'll notice that it's actually quite bitter. And that bitter flavor helps to actually get the gallbladder to release more bile, sort of unclogging the gallbladder over time. And in fact, in a large dose like that, it is also pain relieving. So this is, when it's taken in that kind of intense concentration, chamomile is such a powerful herb for the digestive tract that it can actually be used to help people pass gallstones without really very much pain. It is not tasty when you drink it and it's like that strong. So it's not tasty, but it is extremely relaxing for the central nervous system. And in and of itself, it can be used to help induce sleep. And it's very helpful for people with IBS, which is very often related to stress and childhood trauma. So when you're working with somebody who has IBS as part of their presenting picture, that is almost always connected to the work that you are doing on any amount of trauma or how they're reacting to the interpersonal relationships in their lives. So having something like chamomile and maybe mixing some fennel or mint to help a little more directly with the lower digestive symptoms, that can be a huge relief to somebody with emotional distress and then gastric upset that goes along with that. In that same category of sort of digestion supporting and relaxing, but slightly less digestion supporting, would be lavender, which I'm sure you all have smelled or you're familiar with. Lavender is a little bit aromatic, which, any of these herbs that are very fragrant, oftentimes the essential oils that are present in these herbs are very helpful for digestion. Lavender is particularly helpful for people who have depression and then some amount of anxiety or insomnia that is related to the depression. Chamomile is a little bit more sort of purely anxious types. You can certainly combine them and get the best of both worlds and have a very yummy tea besides. But lavender is a little bit more antidepressant than chamomile. And lavender can be used in many forms. The tea is going to be more helpful in terms of helping with depression over time. Um, this is going to be a fairly mild effect compared to like a Chinese medicine formula or something, but it will be helpful. Um, and in the moment, if you drink a couple of cups of lavender tea, it really can be very helpful for sleep. The other form that now is becoming wildly popular is to use just the essential oil of the lavender itself. So I think that part of why this is so popular is because people love cute little bottles of things. And like essential oils are so cute. They come in these tiny little bottles, they smell great, and then there are two huge multi-level marketing companies that are pushing them like crazy. So these factors have all sort of combined to make aromatherapy like very, very popular right now. Um, but despite any cynicism that I might feel about those two big companies, and despite some of the concerns that I have about the exaggerated claims that are being made, there is a great use for essential oils and aromatherapy in mental health. The number one benefit is that the experience of smelling something pleasant, communicates directly with the limbic system. And if you've ever smelled the perfume or cologne of an old flame, you know how profoundly smell can affect your entire emotional life. And so if you can help a client to develop a positive association or linkage with an essential oil that they're smelling, for example, maybe something like leading them through a guided relaxation in your office, and then having them smell the lavender oil at the same time, and then almost in a Pavlovian way, letting them take that bottle of essential oil or get their own bottle of lavender oil and smell that when they want to repeat that exercise at home. You will help them to access some state-dependent memory of and get back into whatever healing or sense of safety they were able to achieve in your office by using um, the oil both as a behavioral and sort of state-dependent trigger, and also piggybacking on the inherent relaxing benefits that something like lavender oil has. So I think this is also a very promising area for people like yourselves who are probably not going to be recommending internal use of things, but who very well might feel comfortable using essential oils with clients who are interested in this or who feel like that would be a beneficial tool. So two more, and there are many, but three more essential oils that I will mention here. So one of the things that I mentioned on in the description of the session that were not as high on your list, but that I'll at least give you one thing about, was herbs for supporting concentration, focus, and mental alertness. This can be just as important for us when we're working and we're under a lot of stress and doing like mounds of paperwork as it can be for our clients. So rosemary essential oil is wonderful for this. The invigorating aroma really helps to sort of instantly help wake you up. And rosemary, especially if it's consumed as a tea, so this is not as much the essential oil, but if you're having it, you're taking it internally, it does seem to actually help with the circulation to your brain. So there seem to be some physical basis as well as just the sensory part. Peppermint oil can work this way too, sort of that refreshing, waking you up type feeling, or peppermint tea. And then two essential oils that I think are really indispensable for depression in particular. are, one is called neroli, Neroli, and this is comes from the orange blossoms from an orange tree, the actual blossoms, and it has an absolutely heavenly scent, and is very, very calming for the nervous system and slightly uplifting. So not really energizing in like the way that rosemary would be, but uplifting and supportive of someone who's trying to kind of dig out of a hole emotionally. And then the other one is called Melissa or lemon balm. And as an essential oil, this can be very effective for depression. As a tea, it can also be very effective for depression. It does not have anywhere near the interactions that St. John's wort has, and the efficacy is similar when it's dosed properly. Melissa is also, or lemon balm, it's also in the mint family. So it does have digestive support as well. So you can start to think about like what some formulations might be, you know, so somebody with tummy issues and anxiety and depression, we might combine chamomile and lemon balm, and then maybe flavor it with a little bit of spearmint or a little bit of lavender to kind of make it taste really good. Emma says Melissa, like the name. Yeah, exactly. Melissa officinalis, lemon balm. It's the same one you can grow in your garden, and if you grow it in the garden, it will absolutely just take over the way that mint tends to do. Sorry, I hear my dog is coming into the room now, so you may be treated to seeing her hump the couch cushions in a few minutes. So I apologize for that in advance. She has trauma history too, so we'll try to be understanding. Okay, so that's my deal about aromatherapy. It's a wonderful, wonderful tool, and steer clear of anybody who's making claims that essential oils are going to cure cancer or anything like that. Okay. All right, what else did I want to make sure to cover? Okay, lobelia inflata, my favorite friend. So there are people who will say that herbs don't work very quickly. Yeah, I will spell. Lobelia, inflata, inflata. Yes. So lobelia is the perfect answer to people who say, oh, they are so slow and they're so weak and they're so mild in their actions. Frankly, a lot of times, if herbs are not working, there are two reasons for that. Three reasons. One, the preparation that you bought was inert. It was made by a huge company that does not care, and it's old as the hills, and there's nothing active left in there, and you bought these capsules and they're worthless. That could be one reason. Reason number two is that you took too small of a dose. The number one concern that people have about regular pharmaceuticals is of an overdose. And very rightly so, because remember, on this side of the spectrum, things are concentrated. And so it's really easy to have too much. The therapeutic dose and the lethal or the toxic dose are a lot closer together than they are for most herbs. So for most of the time when people start taking herbs, they're still kind of thinking about it as if they're taking a drug. And they take like the tiniest, daintiest little amount of herbs. My mentor and teacher, who has been doing this work for, I don't know, probably 40 or 50 years, he jokes like, how do you know that you've given someone enough herbs? And you say, well, I don't know, Michael, how do you know? And he's like, you do the ear test. You know, you tilt their head to the side, and if the herbs pour out of their ears, then you know you've given them a sufficient dose. So, you know, this is obviously a joke, and obviously it is possible to take too much of a certain herb. Lobelia is a case in point, and we'll talk about that. But most of the time, people are taking such a small amount that they don't notice an effect because they just didn't take enough. A rule of thumb is that if you are buying medicinal tea in tea bags over the counter, the dose that they suggest on the box is only half as much as most people need. So if you weigh, very little, if you're a really tiny person, you weigh like 95 pounds or less, then probably the single tea bag dose that's on the bottle is enough. If you are a 150-pound adult, then probably 2 tea bags is the right dose. And you got to let it steep for at least 30 minutes so that the water can actually extract the chemicals in the herbs. If you are a 200+ pound person, then 3 tea bags and on, okay? I got off on a little tangent there, sorry, about why people say herbs are ineffective. Oh, and then the last reason that herbs are ineffective is because you're taking the wrong herb, because either someone convinced you that, St. John's Wort is the depression herb, and you have depression that actually needs, Xiao Yao Wan or a formula from, an experienced practitioner. And you're taking that St. John's wort and it's never going to help you no matter how much you take because it's not the right herb for you. So those are the 3 reasons why herbs don't work usually, when they don't work. And the good thing is that there's always a solution for any of those problems. You change the herb, you change the dose, or you change the preparation. And generally, we can get a result. Okay, where was I? Lobelia. So lobelia is, as I mentioned before, a parasympathomimetic. Unlike most of the other herbs that have relaxing or sedating qualities, lobelia works quite directly with the central nervous system. And in the last few years, I have become pretty obsessed with Dr. Stephen Porges and the polyvagal theory. And I'll probably spend the next 10 years working on this, but I have a pet theory that part of why lobelia is so effective is because it's somehow working with the vagus nerve and helping people to flip out of essentially like a freeze state. So this is one of the most important herbs that I use with clients who have trauma history. And I know that's something that you're working with, Emma. Lobelia is toxic in the sense that if you take too much, which could be a relatively normal dose for another herb, if you take too much, you will vomit. You will definitely get sick. And if somebody takes lobelia who has vasovagal syncope or a propensity for fainting triggered by heat or dilation of their pupils or these kinds of things, they might faint after taking this herb. So, but where it's really helpful is in combining just a little bit of it with other remedies that promote relaxation in order to give a little bit more potency to those remedies, or using by itself so that you can create a state of calm relaxation in a person without actually sedating them. So, one of the main issues with a lot of the anti-anxiety medicines is that while they may kill somebody's anxiety, they also cause drowsiness, fatigue, or mental slowdown. That is the beauty of lobelia, is that we can actually calm the central nervous system without putting it to sleep. And so people can feel quite alert and relaxed. And sometimes that is a completely new physiologic state for someone to be in, that they don't actually have a memory or an experience of what it's like to be alert and also relaxed. So lobelia is a wonderful ally for supporting that. This is a great one to experiment with on yourself. I would not recommend that you suggest this to your clients, but definitely experiment on yourself with it. Not if you're epileptic, not if you have vasovagal syncope. And the way to do it is to get a bottle of the tincture, which would be like a small bottle, and you take a glass of water, such as this, and you put like 3 drops of the tincture in there, not dropperfuls, just drops, and then drink that. And then tune in and see if you notice any shifts in what it feels like inside your own skin. You might not feel anything with 3 drops, or you might feel something. Depends a little bit on you. And if you don't feel anything after 10 minutes, then put 5 more drops in the water and take that and then see how you feel. And you can keep going like that until you feel something, which for most people will be between 5 and 15 to 20 drops of lobelia, and you will get a really pleasant, alert but relaxed effect. It's also really, really helpful for people with asthma because it particularly relaxes the smooth muscle of the lungs. Okay, there's so many herbs to talk about, but I hope that that was a little taste of some of these individual remedies for you guys. I want to move on, and we can cover them a little bit more in the Q&A section if you guys would like. All right, herb-drug interactions. This is a big, big question that came up in some of the surveying that Erica and I did before this webinar. A big shout out and thanks to Erica, by the way, Erica Cass, for helping to mobilize some awesome social work sort of networks to get people here. So thank you to you, Erica. So herb-drug interactions. Jihan is saying yes. So herb-drug interactions, there are a couple things to think about as just rules of thumb here. Not obviously going into all the nitty-gritty because we'll be here for like an entire pharmacology class, which none of us want to do, I don't think. The first thing is, rule of thumb, not a great idea outside of the guidance of both an herbalist and a psychiatrist to treat the same issue with both an herb and a pharmaceutical drug. So you have depression and you are taking Wellbutrin or Prozac or whatever. Not a good idea to simultaneously take St. Johns Wort. Okay, no worries, Emma. Take care, sweetheart. And you have any particular questions you want to ask before you leave that you want me to do in the Q&A, just type them in and I'll make sure to add them on the recording. And if not, then we'll talk to you soon. Take care. Okay, so don't treat the same issue with the same drugs. Very often, or with an herb and a drug, very often that's going to lead to some amount of an interaction or one thing potentiating the other. There are definitely ways around this, but you have to have a professional on the team in order to find them. The next thing is a little bit harder to know, and it's partly why I lean so heavily on some resources about this topic, and also why I always like to work in collaboration with an MD when somebody's taking medication, is that you also have to understand what are the metabolic pathways through which the drug is eliminated through the body. Is it detoxed through the kidneys or is it detoxed through the liver? And because with psychiatric meds, not with everything, not with anti-anxieties usually, or anything you're using as a rescue, but for the kinds of medication that help with mood stabilization, or that help, the antipsychotics, things that are warding off very serious symptoms, those depend on a constant blood level in the similar way that like antibiotics depend on a constant blood level. So what can happen is if you don't understand how to use the right herbs that are not going to speed up the elimination of the drug from the body, you can actually end up reducing the effective amount of medication that's circulating in someone's system. And if they need 50 milligrams of a substance and now there's really only like, a similar amount to like 30 milligrams, then they're not going to get the therapeutic benefit that they need, and they might even experience withdrawal type symptoms. So this is where if somebody's on anything that requires a constant blood level, generally it's fine for them to have a couple of cups of tea here and there. Generally, chamomile tea is generally not going to be a problem. Culinary herbs are generally not going to be a problem. So like mint, lemon balm, these kinds of things generally would be okay in a small dose. Aromatherapy will almost always be okay. But taking, a big dose of valerian, taking some lobelia, taking some St. Johns wort, not a great idea, because it's very possible that you could induce the metabolism of that drug and throw somebody off. So those are the two main things to understand for herb-drug interactions. This is not, in my clinical experience, this is not as big and scary of a deal as people make it out to be. People manage complex medications with other medications on top of medications. I'm sure you see this every day, the long lists of meds that people are taking. And the meds that people are taking for the problems caused by their other meds. It is not more complicated to manage herbs in relationship to this kind of a thing than it is to manage drugs with other drugs. It's the same thing, and we do it all the time. And knock on wood, I have not yet experienced any of my clients. I've been doing this now for 3-4 years. I haven't had any of my clients have any problems with this. Just implementing common sense and research and basic precautions. So just because someone's taking medication doesn't mean that they can't use herbs. In fact, herbs might be really, really helpful for them. Okay, the moment that we've all been waiting for, finding safe and effective herbal preparations. So in addition to those rules that I mentioned earlier about how to find herbs themselves that are fresh, which really just has everything to do with being a good grocery shopper, finding things that smell vibrant and look vibrant. There are a couple of companies that I will recommend that are doing really good work. If you are of the mind to support small, kind of herbalist-owned companies, I really love and recommend 5 Flavors Herbs out of Oakland. Oh, and I don't have any financial relationship with any of these companies. I don't sell herbs in my practice. I make my living by charging for my time and charging for educational materials like this webinar. I do not sell herbs because I think there is a very strong potential for conflict of interest there. Other herbalists differ from me in that way. I don't think they're wrong. This is just how I work it out for myself. And I want you to know that because I think it might help a little bit just for you to feel confident about why I'm recommending what I'm recommending. But it has nothing to do with personal financial gain. So 5 Flavors Herbs in Oakland, wonderful source for very well formulated remedies for things like sleep. They have tinctures available for all kinds of different challenges. And that is also the pharmacy that I personally work with when I custom formulate for my clients. I don't have a full apothecary because, again, I don't sell herbs, so that would be pretty impractical. But I work with them to create the custom formulas for my people, and they're wonderful. And I've toured their facility, and they're great. So 5 Flavors Herbs in Oakland, and they will ship all over the US. Their back to school formula is great for immune boosting for those of you who are getting ready for the onslaught of cold and flu season. It's a really good one to have on hand just for personal use. And they also have a staff of very well-trained people. So if you have questions about anything that you're going to buy from them, they will be able to answer those for you. In terms of bigger companies, I really like Herbalist and Alchemist. You can order from them online. And then if you're looking to pick something up in the store from around here, Herb Farm, Herb space PHARM, widely available little bottles with the yellow label is a great company, as is Gaia, Gaia, Gaia. These are all totally reputable and good places to source your remedies. Planetary Herbals, which is formulated by my teacher, is another really good company. And you can often get great deals on their products on vitacost.com. So that can be a good resource for people who are not going to be paying Whole Foods or 5 Flavors prices for remedies. A lot of times you can get planetary stuff a lot cheaper than some of the others. I do not recommend their medicinal mushrooms, but all of their other preparations I feel good about. And anything else? Um, there are a couple of other herbalists in town here in DC. Um, Holly Poole Kavana, I'm not sure if I'm saying her name right, has an herbal company locally. Trisha, oh gosh, I'm forgetting Trisha's name. Anyway, there are a couple of other herbalists here locally, and in general, if somebody has trained at Thai Sophia or Maryland Institute, or they have trained certainly where I went to school, the East West School, these are people who I would trust as they're making and recommending remedies. So those would be some other resources to check out locally. There are lots and lots of great companies that I haven't mentioned. Please, I'm going to have my email available on another screen. If you ever have a question, just feel free to email me. I have a 5-minute policy, like just anything I can answer in 5 minutes, I will always answer. So please feel free to ask me if you come across something. And then, for bulk herbs, mountainroseherbs.com, best source for bulk herbs in terms of price, sustainability of the remedies themselves, and just freshness and wonderfulness of the herbs. So if you're ordering some chamomile or some peppermint for your personal use, that is a great place. And then if you want to go for some aromatherapy, I recommend Snow Lotus, I think it's .org, Snow Lotus, which is Peter Holmes's company. And a new company that I've just discovered that's fairly local in Maryland, out in Western Maryland, called Appalachian Valley Natural Products. They have an amazing, amazing array of essential oils, and I just placed like a huge order with them last week, so I'm very excited about my oils coming. Okay, when and how to refer to an herbalist. So I think we've mostly covered the when. The how is a little bit more complex because herbal medicine is not covered by health insurance. So if you are working with people who are not able to afford out-of-pocket health services, this becomes trickier. What I would recommend in that particular case is one of two things. Number one, talk to me or talk to another herbalist who's local to where you live. You can find us often through the American Herbalist Guild website. So it's the AHG. Just Google American Herbalist Guild, and there will be a drop-down menu there which says Find a Practitioner. And wherever you live, you can find somebody local. I work with people from all over the world, but if we're talking about coming in and providing like a one-day clinic or something at a nonprofit, I can't do that if you live in Wisconsin. So the AHG is a great place to find herbalists and herb schools. And you can certainly approach somebody. Almost all of us as herbalists have a high degree of social justice running through our, passion for social justice running through our veins, just like social workers tend to have. So if you approach us and we can work out the possibility of a collaboration around creating a one-day clinic or offering a seminar for client education, or seeing if we can partner with some of these herb companies to help get us some free samples like all those evil drug companies do, the possibilities are really endless. We just have to apply our will and our creativity to bringing them into being. So certainly contact me or reach out. Most herbalists would be thrilled to hear from somebody who wants to collaborate with them in this way. So that would be one option. With clients who have the ability to pay out of pocket, really it's a lot simpler because they can work just directly with a practitioner one-on-one, which is the best situation and which I wish were available to every single person who would ever wish to access these services. But until that day, for people who do have that ability, Certainly, you can feel free to refer to me. I would love to talk with your people and see how I can help. And if someone really wants to work with a local practitioner and they're not here in DC, then again, you can go to the American Herbalist Guild website and or just refer them to the AHG website and they can find a practitioner there. Not all herbalists consider themselves to be specialists in mental health, as I do, but all herbalists are, because we're not licensed, we are really pretty on it in terms of what we self-assess our scope of practice to be. So if somebody comes to me with cancer, I pretty unabashedly say, that is not my area of expertise. I really am not the person for you. You should talk to Michael Tierra or whoever, and you'll get similar treatment from other herbalists who feel that the person that you're referring is out of their scope. I think that's really it in terms of this piece. And then we have reached Q&A, and Jahan, you're the last person standing, so you have the floor in terms of any Q&A that you want to ask now. And then this is my email, just melanie@psycheinsoma.com. Please feel free to use that liberally. If you have questions that are overflow from this presentation, or if you have any interest in talking about other possibilities of work together or anything at all, just reach out and we can chat and put our heads together about that. Okay, Jahan, fire away. I am at your service. Safe, common drug and herb combinations that you have seen work and be effective. Yes. What I have seen work really well is the combination of somebody who is on an SSRI and has anxiety that is not being treated any other way. Well, was being treated with psychotherapy. Almost all of my clients that are mental health people are working with a psychotherapist. It's almost like a condition that I have for working with people, because I just think that's how you change your brain. Like that's the way. So in combination, psychotherapy plus antidepressant that seems to be working for the depression, that anxiety that's untreated, in different people, different combos will work. The two herbs that I often use are skullcap, which is Scutellaria laterifolia. This is for anxiety that shows up more in the form of like tension, anger, lashing out, anxiety that turns outward more. And this is usually in a more type A, high functioning kind of person. Skullcap with lobelia that I mentioned earlier. The other kind of go-to combination is an herb called passion flower, Passiflora incarnata. Again, with lobelia usually, because that's like my booster that I like to use. And passion flower is more sedative than skullcap is. And so it's a little bit better for sleep, and it's a little bit better for anxiety that goes along with obsessive thinking. So anxiety that turns inward and gets into that like mental loops that they can't stop from going on. The downside to passion flower is that the dose that you need to help with the anxiety is pretty close to the dose that's going to make you sleepy. So that one is a little bit trickier to dose correctly, but generally what I do is I tell people the dosing instructions similar to what I told you about the lobelia, like, okay, take 10 drops, see how it feels. If you feel good, then stop there. And if you feel like you're still anxious, take a little bit more. And one of the benefits of that kind of dosing strategy, which you could easily steal that if you're using aromatherapy, like you can take the behavioral part of it. The behavioral thing that happens there is that people actually notice how their body feels, which for our culture is not something that we're trained how to do. And for people with trauma history is something that they have specifically stopped trying to do. So there's actually a hidden sort of therapeutic uh, intervention in just that dosing instruction of like noticing how you actually feel. That's like a little bit of mindfulness that we're asking someone to bring to bear. And there are more combinations that I've seen work. That is the one that I would generally say like I use most often. Um, do you have to feel an effect in your body immediately to know that it's working? Yes, with the anti-anxiety remedies. Anxiety is sort of fast moving. It can come on fast, and it can dissipate very quickly when you have the right remedy, whether it's an herb or a drug or a mind-body intervention. You can also have slow burn anxiety that's just kind of there in the background all the time, for sure. But even that can really dissipate very quickly, even just with breath work. If you've ever done breath work with your clients, I mean, people can drop from an 8 out of 10 to a 5 out of 10 in 3 minutes with breath work. So when it comes to anti-anxiety stuff, yes, then if it's working, you're going to feel it right away for most of the time. Some more like nutritive kinds of remedies for anxiety, which are going to have more to do with like restocking magnesium and B vitamins or omega-3 fatty acids, then you're not going to feel an immediate effect. That's going to be more of like a long-term kind of a thing. With remedies for depression, um, with remedies to help with ADHD, those can really vary. Sometimes you'll get um, sometimes you'll get like just a feeling of a little bit more well-being, like a little bit more vitality, but it's hard to say if that's a placebo or if that's just a like relief that comes from having something to try. Um, those things tend to take a little bit longer. Usually what I see with depression is usually about 2 weeks with sort of custom constitutional type remedies. Usually about 2 weeks is what I give it. If it is deeply related to hormonal stuff for women, so like more like a PMDD or serious depression that is related very much to menstrual cycle dysregulation, that can take up to 3 months. Like you'll get benefit within month one, but it will take about 3 months for all of that hormonal stuff to respond fully. Yeah, but the anti-anxieties, they work really fast. And the thing that's great about that is it can help people to build confidence in the medicine. Um, and then the herbs can work in the same way that rescue drugs work, in the sense of just having this in my back pocket helps me to feel more confident about moving in the world, because I know that if I have a panic attack, I have something that works. How do you measure nutritional deficiencies to determine the proper herbs? Well, I'm not a dietitian, so I don't actually measure nutritional deficiencies. Um, what I do is I I essentially do pattern recognition. So if someone, I mean, it gets slippery because you don't know traditional Chinese medicine terminology. So I could say what this means in TCM terms, which is really what I'm doing, but it won't make any sense. So it's not exactly correct because I'm not a dietitian, so I'm not fixing anyone's magnesium according to the law. Um, but some of this is just different names for similar phenomena. So if someone gives me a diet log or they tell me roughly what they eat in a day, and I realize that there are no green vegetables, then just as a human, I know that that's a vital part of their nutrition, and they're probably low in magnesium and folate and these kinds of things, and they need to get that in. Now, if they aren't eating green veggies because they have serious dental problems and they can't chew, or because they're extremely busy and they don't have time to actually eat a salad, then getting those nutrients in a liquid form of an herbal infusion is amazing. It's like it's a perfect win-win. Um, so that's kind of how I do it. It's more, and I hate the word holistic because everyone uses it, but um, it's not a specific measurement, and it's not like what a dietitian would do in terms of the real scientific rigor of that. Okay, last question. Thank you. Um, Tinctures, the questions are tinctures more effective, I'm guessing, than teas or than capsules? Um, it depends. So we're dealing with chemistry when we're dealing with herbal medicine. Um, Now, the way that we're working with that chemistry is often through the senses rather than through a complex lab analysis, but it's chemistry nonetheless, just like baking is chemistry. So when you are taking an herb that's just a raw plant and you're extracting it into something, you're extracting it into water, then that's a tea or an infusion. If you extract it into alcohol, it's a tincture. You extract it into glycerin, it's a glycerate. If you extract it into oil, it's an oil. If you separate it, you distill it, then you get just the essential oil and water, and then that's an essential oil and a hydrosol. So these are all preparations that are made from the herb, or you can put it in vinegar. Each of these have different chemical properties and they extract different things. So it depends on what you actually want out of the herb, which of them will be the most effective. Now, water is the best solvent in all of the universe that we know about, which is why life on Earth can exist the way that it does. Because water is such an amazing solvent, and it has the ability to change state at the temperatures that we have here, on the planet. So tea is great because it tends to really pull out, it definitely gets the minerals, and it gets a lot of the other beneficial chemicals, the polysaccharides. I'm going to blank on all of this, but it gets a lot of those chemicals out. Alcohol, so tinctures, so tea is hands down the most effective when you want nourishment in any way. It's also really good at getting the essential oils out, so it's also best for digestion in general. Tinctures tend to extract the alkaloids a little bit better. So some of the more sort of the harder hitting, more drug-like effects are going to come out in the tincture a little bit better than a tea in some cases. 9 times out of 10, though, the thing that makes the difference between whether I recommend a tincture or a tea is compliance. So obviously, if someone can't use alcohol because of alcohol abuse or addiction history, tinctures are just out of the picture. We're just not going to use them no matter what. Um, and if someone tells me they're not going to make tea because it's not convenient and they don't have a way to do it in their day, or if they're using a remedy for anxiety, which needs to be ready like super fast, then tea is not practical because it takes too long and it requires equipment in order to make. So 9 times out of 10, the reason why I choose one or the other is much more about lifestyle than it is about actually what is the perfectly suited medium, though sometimes the perfectly suited medium is really important. Like lobelia, do not have lobelia in a tea. It is disgusting and it does not work and it is disgusting. So I think that's one time I would not use something in a tea. And then do I specialize in aromatherapy as well? No. I do not consider myself an aromatherapist. I am learning more and more about aromatherapy and I use it in a rudimentary way. But I use it I honestly use aromatherapy most when I have a client who, um, where there are herb drug interaction issues or where there are compliance issues, and I need to give them something. Um, and I don't feel like the other tools in my toolbox are appropriate or are going to work. That's how I am currently using it. I I'm sure that over time I will learn more about it. I'm kind of on a little bit of a personal aromatherapy kick right now. But I think it is most effective for infectious disease, which is not particularly my thing. And a little bit for mood, mind, emotion stuff, a little bit for musculoskeletal complaints, skin and that. But it isn't the most effective tool for mental health. But it may well be one of the most effective tools that you guys feel comfortable recommending. Okay. All right. Thank you all so much. Thank you for making it all the way to the end of this presentation. We've gone over quite a bit, and I would apologize, except I've just enjoyed sharing with you so much. And I'm so glad that Johanna, sharing it. This is great and helpful. I will definitely email you. Please, by all means. I will be on vacation for the second half of August. So if you get an annoying vacation autoresponder, please forgive me. But I would love to chat with you, and I would love to bring some of this forward a little bit more here here in DC and as much as we can throughout the world. Our system is so broken, and every little bit of resources that we can start getting out there is we need it. So I'd love to support you guys in the work that you're doing. All right, my darlings. Well, thank you so much for watching, and I will look forward to talking to you very soon. Good night.